that there probably was a somewhat insufficient development of the immune system. Therefore, the immune system is not as well able to discern what is a true pathogen or bad guy as compared to what are these normal things like foods or pet dander or pollen that we shouldn't attack. Hey everyone, welcome back. Let's talk more about probiotics and how they can, in this case, improve children's health, oral health, and with infections. And there's a lot here for us to unpack. One of the studies for which, looking at our overview, does the specificity regarding strain matter? Very elegant study here. And why this helps or could help is because you can make the selection of a probiotic potentially more confining and more difficult if you require a highly specific strain. And if you don't, it can be much easier to use a probiotic, and this includes for your kids. Do probiotics improve tolerance to infant formula? So if you are a parent and you're trying to, let's say, sleep well or not have a lot of colic and crying during the day, this potentially could be helpful if probiotics can reduce colic associated with formula use. And we'll talk about probiotics for kids and allergy and kids with gastrointestinal symptoms. We'll pivot over to probiotics for oral health, also known as halitosis. And when we cover how the researchers are testing for bad breath, I think you'll get a good laugh out of that. And a few other studies similarly regarding probiotics for oral health. And then we'll finalize the discussion with probiotics and infection. We discussed before how probiotics may help with COVID, with upper respiratory tract infections, post-surgically, even with C. diff potentially, as we'll discuss. So let's jump in and start the conversation with probiotics and kids' health. And in this study, it was a review paper of 23 randomized control trials. They were looking at kids with diarrhea, with H. pylori, with atopic dermatitis, so skin breakouts and lesions, and also respiratory tract infections. So this is probably something that's very applicable. Your child may have diarrhea periodically. We know that gastrointestinal syndromes and symptoms tends to correlate with imbalances in the immune system, which can then make your child more sensitive to environmental stimuli that can lead to atopic conditions like allergic rashing and urticaria hives. And of course, you're hopefully wanting to reduce the amount of time your child is out sick or bring sickness home from school or daycare to you. So looking at different probiotics can help us determine, can A, they help, and B, which one may or may not be the best. So in this case, they were looking at different strains and trying to determine if there was any benefit from one strain versus another. Now, if you're not privy to the strain piece, and this schematic will help, but I'll also, of course, narrate, you've likely heard of lactobacillus. So this is a genus. Then we can get more definitive and say lactobacillus acidophilus, acidophilus being the species. We can go further yet still and say lactobacillus acidophilus M23, strain M23. So this study was looking at different strains. And when you hear, oftentimes this is sort of echoed in research papers, we need this strain specificity, this certain strain. This is what they're talking about, all the way down to the M23 designation. So what did this study find regarding the strains? Do the strains matter? Well, 91% of the studies found no difference in effectiveness between different strains. So this at least tells me that if you're trying to help your child with diarrhea, with H. pylori, with atopic skin conditions, and or with respiratory tract infections, the strain doesn't seem to matter, at least for this lactobacillus acidophilus example. But I also want to draw your attention to this. All right, this is a direct screenshot of the conclusions from the paper. Based on indirect comparisons, this rapid review demonstrates insufficient clinical evidence to support or refute the claim that probiotic effects in children are strain specific. Now, the way I read this is a admonition of some of the bias that currently exists in the research community regarding strain specificity. Because when I look at 91% of studies find no difference regarding strain, then that tells me we do have some support that the strain specificity does not matter. Perhaps the data could be better, but how I interpret this, and this is something you've probably seen in other areas, we know that funding can influence thinking. And this is why there are progressively more regulations between funding for research, between how pharma can influence doctors or how sales reps can influence doctors, right? So upstream to research is funding. And some of the incentives here seem to be pointed in the direction of, well, this, let's say, pharmaceutical or nutraceutical company makes a strain, they fund a study for a strain, and therefore there's an incentive to report on the impact of that strain specifically and not say, well, we found this strain helps and we spend a fair amount of money documenting that, but oh, by the way, other strains also help. Now, as more evidence is coming in, this study case in point, we're starting to see somewhat irrefutable evidence that there is a case to be made that the specificity of the strain doesn't seem to matter. And why this matters for you is you can step outside of the marketing claims that you need to have this strain, or, if you're trying to, let's say, improve your child's diarrhea, you must use this strain. Because coming back to the simple example of your kid having a few different symptoms, now you have to potentially buy 3 different probiotics with the certain strain for each one of those symptoms that you're trying to optimize for. So there's a lot of utility here, which tells us that the use of probiotics is fairly simple, at least my interpretation from this study. Okay, moving on. So this could really make a parent's life a lot easier. They were looking at, do probiotics improve tolerance to oral formula? They looked at breastfeeding alone, probably the best way to go, but in some cases, that's not a viable option. Compared to formula alone, compared to formula plus probiotics. And the probiotic here was Lactobacillus reuteri. Now, compared to formula alone, taking the probiotics in the formula led to better tolerance, less difficulty passing stool, reduced colic, yay, that's a huge win, and less spitting up. So the addition of the probiotic to the formula led to similar health as to breastfeeding. So if you are formula feeding, I would highly encourage you to use a probiotic, in this case, perhaps Lactobacillus reuteri, although I don't think you need to be quite that specific, due to the fact that you'll reduce difficulty passing stool, colic, which can manifest as crying, poor sleep, therefore parents are woken up, therefore nobody's happy, and also less spitting up. So great news there. And this, it was an observational study, so we do have to be a little bit careful. Sample size was pretty good, 1,700 individuals. So great news for parents who are formula feeding. Probiotics seem to help improve tolerance to the formula. Okay, now what about probiotics to reduce the risk of infants developing allergy? So in this case, they examined children over time, and they were either put into a control group or into a probiotic group. And they were given E. coli 083, and it was given within 2 days of delivery. And likely the way that this was dosed, this wasn't super clear in this clinical trial of 83 infants, but it was likely dosed 3 times per week for 4 weeks. Now, at a 10-year follow-up compared to the controls, here's what happened. Those taking the probiotics had a lower incidence of allergy, and there was also no effect on the gut microbiome. So less allergy, no impact on the gut microbiome, which hints at another concept we discussed on the podcast before, which is, while we should be somewhat concerned with the microbiome, it's not the end-all be-all for predicting gut health or systemic health. And here is a fantastic chart from this study. What you're looking at here are the three groups: those who had allergy, those who were healthy, and those who were given the probiotic. And you're looking at from birth, 0, all the way out through 10 years. And for those of you not watching this, what you're seeing is charted the levels of the cytokine interleukin 10. And the higher interleukin 10 is, typically the less allergy you will see. Now, as you see here, the allergy group had kind of a flat line of their level of IL-10 over time, which tells us that there probably was a somewhat insufficient development of the immune system. Therefore, the immune system is not as well able to discern what is a true pathogen or bad guy as compared to what are these normal things like foods or pet dander or pollen that we shouldn't attack. So the IL-10 helps regulate this tolerance or this ability to discriminate things that should be attacked, pathogenic bacteria, as compared to a food particle, grass, pollen, what have you, that should not be attacked. So the allergy group has a fairly flat-line level of IL-10 over time. Their immune system doesn't seem to be getting healthier or more attuned. In the healthy control group and in the probiotic group, however, you see a very tightly correlating up and to the right evolution or increase of their IL-10 levels over time, telling us that that probiotic taken within 2 days of delivery, at least in part, seems to have had a beneficial impact and allowed the children who were intervened with to have less allergy, better IL-10, and have IL-10 levels that look more similar to healthy, non-allergic controls. So this was really just a very elegant study, and it helps us understand that probiotics, coming back to my concept from a moment ago, not only can help the microbiota, yes, but perhaps in some instances, more importantly, can improve the immune system, and in this case, doing so through the cytokine interleukin 10. Alrighty, moving on. Can probiotics improve gastrointestinal symptoms in children? This was a meta-analysis of about 1,300 children who had functional abdominal pain, and they were given either placebo or probiotics. And just calling your attention to the fact that the formulas, probiotic formulas, varied, including bifidobacterium in some cases, lactobacillus in others, and bacillus coagulans in others. So there's not consistency across the formulas. However, we see that irrespective of formula type, there was still an improvement in this gastrointestinal pain when using probiotics, and there was no difference in adverse effects. So 2 things here to take home. 1, probiotics can improve abdominal pain in children, and 2, it doesn't seem, at least across these 3-ish different formulas that were used, that the formula type seems to make a difference. Again, hinting at this concept that the strain doesn't seem to matter and the formula specificity also doesn't seem to matter. Coming over to probiotics and oral health, and here we have our halitosis or our bad breath study. This is a meta-analysis of 7 randomized control trials, placebo versus probiotic. Again, the probiotic varied by study, including lactobacillus or streptococcus or this other probiotic I actually have never even seen before, Wasselia cibaria, I think. I have that's a tough one to pronounce, sorry. Probably butchering that. Compared to placebo, probiotics led to an improvement in mouth odor and also a reduction in these VSC compounds or volatile sulfur compounds. Now, coming back to this study, I don't want to overlook this. The way that they tested halitosis or bad breath was they had participants keep their mouth closed for 1 minute and then blow into the face of a researcher, and the researcher takes a smell and grades the odor. So I commend you, researchers, for your commitment to the cause and would not want to be on that research team. So what's happening in the mouth when the probiotic is exerting its favorable impact? In the mouth, of course, you have amino acids. cysteine, methionine, tryptophan, lysine. And as you've probably also heard that many amino acids are sulfur-based amino acids, which can do certain things like help facilitate detoxification. However, bacteria in the mouth also metabolize these amino acids and can form these volatile sulfur compounds, which have a poor odor. So part of what underlies halitosis is, said simply, dysbiosis or disruption of the bacterial colony in the mouth, metabolizing amino acids, which are going to naturally be occurring in the mouth, and turning them into these sulfur compounds. Now, no one likes the smell of a sulfur flatulence. So similar thing with sulfur-laden breath. You will not be the most popular person at the office party. And thankfully, probiotics seem to help with this condition also. And what about probiotic lozenges to improve oral health? Randomized control trial, 60 participants with gingivitis, so inflammation of the gums essentially. And they were given either probiotic plus teeth cleaning or placebo plus teeth cleaning. And they saw a reduction in gingivitis prevalence of about half. So 63 in the placebo versus 33 in the probiotic. And there was also a reduction in gum bleeding and oral inflammatory markers. So one of the things that may come up if you have halitosis or gingivitis is using a mouthwash. And one of the things that we occasionally recommend is for people to use probiotics as a mouthwash. And in this case, they use chlorhexidine, common mouthwash, antiseptic mouthwash, versus a probiotic mouthwash. Again, the exact constitution of the mouthwash varied because this was a meta-analysis of 10 clinical trials. Irrespective of the fact that the formulas were different, the treatment and either treatment led to improvements in gingivitis and improvements in plaque formation. So there was similar improvement with chlorhexidine versus a probiotic mouthwash. This hints at one of the concepts we've discussed many a time, which is start with a probiotic before considering something that's antiseptic, antibiotic, or antimicrobial. Now, context here matters, right? I don't know what exactly you might be suffering with. So if it's a life-threatening infection, we wouldn't want to, go through this hierarchy, so to speak. So always check this with your doctor. But as a rough hierarchy, when we're trying to optimize for a pathogen, an infection, dysbiosis, overgrowth, it seems reasonable, given data like this, and there's a lot of them, to start with a probiotic intervention, reevaluate, and then consider the antiseptic, whether it be a mouthwash, an antibiotic, or an herbal antimicrobial. Again, always check this with your doctor because it's context dependent, but this is a general structure, which is important to keep in mind because very often, especially in alternative medicine, there is a propensity to jump very quickly to antimicrobial therapy. And this is my opinion, but there's also data to support this. When you jump to antimicrobial therapy, before laying more of a foundation with probiotics, you tend to fall into a syndrome, or you're more likely to fall into a syndrome of seeing a short-term response from the antimicrobial, from the antibiotic, and then a regression. And sadly, what can happen in some instances is people can start to form the belief that I've got this thing inside of me I got to kill, and it keeps coming back, and I got to keep trying to kill it and kill it and kill it. I just want to hammer it harder with antimicrobials. And that might actually be missing the key point of this interventional hierarchy we oftentimes discuss. Remember, probably the most hallmark study that depicts the efficacy of this is the one finding about a 50% clearance rate of SIBO, small intestinal bacterial overgrowth, with either probiotics or with antibiotics. However, if they are combined, the rough clearance rate of SIBO goes from roughly 50% to 85%. So this is why we want to combine these therapies, but knowing that the probiotic alone might be sufficient to lead to resolution, start there, reevaluate, and then consider the probiotic plus whatever the antibiotic, antiseptic, or antimicrobial might be. So another great study finding that these same rules apply even in the mouth. And here are some oral probiotic recommendations. The most common probiotics used orally were Lactobacillus salivarius, Lactobacillus reuteri, and Streptococcus salivarius at a dose of 100 million to 4 billion, dosed 1 to 2 times per day. And here's a few products for you. BioGaia's Pro Dentist Lozenge, Bliss Teeth and Gums Lozenge, Culture Care Probiotic Gummy, and DIY Probiotic Mouthwash, which is just made with a probiotic that you put or mix with water and simply swish around in your mouth for about a minute. So lots of options. And I would say simply, you can try using whatever probiotic you have at home as a mouthwash. If it's a capsule, open it up and mix it with water, or you can try buying one of these. And just be practical. Use it for anywhere from 2 to 4 weeks and see, is the symptom orally that I'm trying to contend with improving? If so, great. If not, then consider other options. And again, always check this with your doctor, of course. Okay, probiotics and infection. I want to start with just framing the fact that one of the underappreciated mechanisms through which probiotics exert their benefit is because they're antimicrobial. And this great schematic that we've covered before hints at a few of these, but I just want to touch on 3. Competitive exclusion of pathogens, meaning the probiotics prevent pathogens from being able to establish a niche. Directly producing antimicrobial substances, so it's fighting fire with fire, I guess you could say. Probiotics actually are antimicrobial, antibacterial, antifungal, and antiparasitic. So they directly produce compounds that fight off these things that you don't want. And then also, as we discussed earlier, outside of the microbiota effects, outside of the effects on the bacteria, there's this impact on the immune system and modulation of things like dendritic cells, macrophages, and various interleukins. And even down here, ties in tacitly to things like toll-like receptors. So remember that probiotics are very immunomodulatory and also antimicrobial. So with that, we then go into some of the outcome data, meaning, well, if these mechanisms are meaningful enough, we should see it manifest in favorable outcomes when treating various infections. So enter a meta-analysis of 9 randomized control trials in critically sick patients in the intensive care unit who were given either nothing control or a probiotic. Per the usual, given that this is a meta-analysis, the strains of the species varied across studies, including Lactobacillus, Lactobacillus bacillus or Enterococcus. And compared to controls, there was a 27% reduced risk in hospital-acquired infection, which is great. There was no impact on mortality. So 2 things here we have to parse. You'll have a reduced likelihood of hospital-acquired infection. Will this make the difference between life or death? It doesn't appear so. So some benefit, but as I've said before, probiotics are not a cure-all. They're not a panacea. And just important to have a healthy respect for how we use this tool. Looking at probiotics in COVID patients who had a mild COVID infection, they were given a soil-based probiotic, and they found a shorter duration of symptoms, a shorter fever duration, and less digestive symptoms. And this is one of a growing number of studies that we discussed on the podcast, finding favor for probiotics in reducing symptoms and severity of COVID. And this is just a fantastic chart from that study. The researchers here are commenting the probiotic group was 1.7 times more likely to have faster symptom resolution. And what you're seeing here is over a 20-day period, they plotted out day over day the symptom severity of controls versus those with probiotics. And what you see is there is a favorability in terms of the probiotic group. Their symptoms are going down more quickly than those in the control group. So just one more point adding to this body of data showing us that probiotics seem to have a favorable effect on COVID. And another study here, a randomized control trial, looking at, can probiotics help with Staphylococcus aureus? And again, being a randomized control trial, we're looking at either placebo or probiotic for the intervention. And after 1 month, Bacillus subtilis, so a soil-based probiotic at 5 billion CFU per day, eliminated more than 95% of the total Staphylococcus aureus colonizing the human body without altering the microbiota. So just another great data point showing us that probiotics seem to help favorably modulate the microbiota, clear infections, and also not have any deleterious effects on maybe killing things that you don't want or causing dysbiosis. And post-surgical outcomes in colon cancer was examined in a meta-analysis of 20 randomized control trials, and they wanted to see, would antibiotics versus probiotics show one of these to be better in reducing post-surgical complications or infections specifically. And in this case, only antibiotics led to reduced post-surgical infection. So, as we've said before, probiotics have a fairly robust body of data documenting their benefit, but they don't work for every condition, every time, every place. And so, again, we want to have a reasonable expectation and perspective on probiotics. Would I still use them in this setting? Probably. Perhaps you'll have a lower risk of a hospital-acquired infection as the other study found, but perhaps it's different in colon cancer studies. So we want to, again, be careful with how we think about probiotics. And certainly, I think maybe the one thing to take away here would be discuss it with your doctor. And in this case, I would, if it were me personally, I would rather be using probiotics plus antibiotics as a hedge rather than antibiotics alone. However, on the other side of this argument, we don't want to be overly altruistic or idealistic and think that probiotics will resolve every issue all of the time. And if your surgeon is really recommending an antibiotic, then at very least you can use them together, the probiotic with the antibiotic. And coming to Clostridium difficile, and this is one I really hope people will take note of, in part because we know that roughly, in estimates on this vary, 20, 40, maybe as high as 50% of people who have C. diff are actually asymptomatic, meaning they have no symptoms. And what I've seen happen in some cases is someone isn't feeling well. They have some symptoms, but not the symptoms of C. diff, which are mainly chronic diarrhea, in some cases bloody diarrhea. And their alternative healthcare provider says, C. diff, we got to treat that. Come in guns a-blazing with antimicrobials or antibiotics. And they haven't matched the symptom profile to be able to say, well, this is the syndrome of symptoms that's associated with C. diff. And they then start really hammering people with antibiotics. Where, you have to make sure the presentation fits this being symptoms driven by C. diff. Again, because some people have this with no problem. But then B, you want to be cognizant of the fact that, as we've already sort of woven into the conversation here, that you don't always need an antibiotic. Now, again, per all of the recommendations, discuss this with your doctor, but the main point this study shows us is that probiotics alone led to a reduction in the recurrence rate of C. diff. So probiotics alone may be viable to resolve this problem. Again, coming back to this interventional hierarchy, start with a safe and gentle intervention like probiotics, then consider an antibiotic, and also remember to be careful because sometimes C. diff is overtreated and we want to be aware of that. Now, there was also some adverse events, mild to moderate gastrointestinal side effects. And I wish we had better data knowing if these were shorter term or longer term. I'm assuming that there was probably some shorter term turbulence. And this is one of the things with those whom we consult and advise. We will often say, be careful not to jump ship too quickly when trialing a probiotic. So 2, 3, 4, 5 or so days of turbulence in the gut may not be abnormal. And if you get to about the week mark and those things seem to be abating, that tells you that this was some sort of adjusting reaction. I don't think Herxheimer's is the right way to describe this. And if the symptoms, the negative symptoms or reactions persist beyond a week, then that may tell us that this intervention is not the right intervention for you, which is also why we break the probiotics down into the 3 different categories so that you can try one at a time, because in some cases, people react negatively to one formula, one category, Lactobacillus and Bifidobacterium blend, as compared to a Saccharomyces boulardii, as compared to a soil base. So in some cases, probiotics generally will not be a good fit. That's fairly rare in my observation, or more likely, it's a transient reaction that will abate within a week, or one of the 3 formula types doesn't sit well with the individual, and therefore you use the other 1 or 2 types to tolerance. So anyway, a few notes there on C. diff. And what about probiotics to improve respiratory tract infections? Another great data point here, meta-analysis of 39 trials, probiotics versus placebo. And again, the type of probiotic used varied, and I keep trying to tie this in so that people can be a little bit prepared to confront all of the marketing claims that you get hit with online. You know, this is the best probiotic for depression. This is the best one for that. This is the best one for SIBO. This is the best one for H. pylori. It doesn't seem to work that way. So probiotics led to a 9% lower risk of respiratory tract infections. And look at this, 22% lower when consumed as fermented dairy products. So this counters what I would say is the general trend in the data, which is probiotic supplements tend to work better than probiotic foods. However, when we combine them, that may be the best overall. And there might be some cases where the food the food vectored probiotic is better than the supplement. So always remain open-minded, I suppose. And additionally, there was a reduction in duration and severity of the infection. So less infections, and also when you did have them, the duration and severity was less. And that's also important to keep in mind, because if you go into the experiment, let's say you're going to try a probiotic for a while, maybe going into cold and flu season, and you get sick and you go, these things don't work. Well, that could be one way of looking at it, but it's important to have the expectation that you're not going to bring your risk down to 0. However, you will see, even if you are sick, a reduction in the intensity and the severity, intensity, and the duration of not feeling well. So great evidence there. And also, I just want to quote here, benefits did not significantly differ by the number of strains, genus, or dose of probiotics administered. So again, I keep sharing this because oftentimes people want to have the magic recommendation for probiotics. And, even in our advising of individuals, they'll think that I have some magical, dose or what have you. And while we are actually working on updating some of our general recommendations, you'll see that they're fairly general, and there's not this, let's say, chart, right? Where if you're this old, this sex, this condition, you match it with this probiotic, this species, and this dose. It makes the probiotics more complicated than they need to be. And also what I think ends up happening is people get distracted and they don't think more about their health as if there were a health project manager, right? What are the therapies that can be helpful? Dietary, lifestyle, supplemental, but perhaps medications. And then how do we sequence these in a series of experiments to figure out what personalized approach works best for me? So when we get rid of the superfluous, irrelevant details, we can focus on application. And that's one of the themes here that I hope is coming through. And that is it. So hopefully this helps you see the breadth of conditions for which probiotics can help. And also that we don't have to be highly meticulous with the dose, with the duration, with the species, with the strain. And again, we have materials that can help you with selection and utilization of a probiotic. And we're always updating these, but the more data that comes in, we see that, boy, we can sort of have a regression to the mean in terms of how we look at probiotics and not need to pull people into seemingly 1,000 directions with different products, different doses, and keep this simple. Zoom out, coming back to that project manager analogy, and think about probiotics as one step in perhaps a few steps of change that you go through in a somewhat isolated fashion so you can evaluate this step, achieve this level of resolution. Now we'll carry that forward, go on to the next step. And usually people need just a few steps, just a few different changes, diet, lifestyle, gut interventions, let's say, and then they're able to get to the pinnacle improvement that they're looking to seek. Whereas oftentimes in health education, the new thing, gadget, gizmo, mechanism, theory, supplement is distracting, and people are looking for kind of a all eggs in said basket intervention will cure all of my ills. And sadly, this leads people away from what do we have in the toolkit that's been studied, been shown to be safe and effective, and then how do we use those? This fundamentals approach is really much, much more effective. And this is why we term this as our diet, lifestyle, and gut health fundamentals approach, because it really helps to filter out the noise and give you a path toward getting well without, again, all the rigmarole, expense, and what have you of the bells and whistles. Okay. So anyway, hopefully you enjoyed this as much as I did, and we'll talk to you next time, guys. Thanks.